I want to start first by turning to Mr. Lake. As many of you may know, 6 years ago, Oklahoma reached a settlement in a class action lawsuit and agreed to make very ambitious improvements in child welfare services, so needed in a state that has very high rates of child abuse and neglect. In fact, the first words in that document were from civil rights activist Marian Wright Edelman. If we don't stand up for children, then we don't stand for much. Oklahoma agreed to pursue major goals in a 5-year plan, among them recruiting more foster parents, raising their payments, cutting workloads for staff, and shifting away from using shelters for abused and neglected children. So tonight we're talking about foster care, but I'd also like to step back and ask Mr. Lake, overall, you came to Oklahoma to implement the Pinnacle Plan, the name of this set of goals. And so how do you think it's going? And after really 6 years and a 5-year plan, do you think we're anywhere close to being removed from oversight from these special monitors that we have?
It's a tough question because you have to understand the terms of the settlement agreement, I think, first. Excuse me. And it's unique. Oklahoma's agreement is unique around the country. In most states, children's rights organizations have sued the state, and it's gone to federal court. The courts ruled, let's say, against the state, established monitors to judge the state's progress towards set targets, and that's pretty much it. And the monitors just check to see on progress, report back to the court, and as a result, states generally never can get out of these settlement agreements. I came from Tennessee. They finally got out of their court suit last spring after 17 years. So our agreement, however, is really a contract between us and the children's rights organizational people, and it sets forth a different way of measuring our progress towards our goals, and that's by good faith efforts towards significant and sustained progress. So it's meant to be a judgment about our efforts, our strong efforts to try to meet the targets. It doesn't necessarily mean that we have to meet every target, but we're supposed to be demonstrating sustained and significant progress. So with those parameters in mind, I would say that we have made, in some areas, remarkable progress, and in some areas we have a ways to go. It was, in my judgment, a very deep hole to climb out of, and I could go into more detail about Oklahoma's unique situation, but that has made it more difficult.
Were there a specific number of targets that we had to either achieve or make sustained progress in? And wasn't it around 24 or 30 or something that it can? And how many of those do you think we're getting much closer to achieving?
Let's see, we had 7 major areas and 41 different target outcomes to work towards. So that's another reason why progress all across the board is very difficult to achieve. We're measured every 6 months by the co-neutrals. Those are 3 individuals with expertise in child welfare who are agreed upon by the plaintiffs and by the agency to guide this process and to measure our progress. They call them co-neutrals because it's supposed to be different than just plain monitors. And it's unique also in the fact that they are there to help guide us and provide expert advice, not just to measure and say you did or you didn't. So I think that's of value as well. So I think on our last report, we had good faith efforts across the board except for several categories where they deemed that they needed to reserve judgment to make a determination at a later date about whether we had made good faith efforts. Why is that a big deal? Because if we can achieve good faith efforts in all of those areas, then it starts a clock running so that once we have achieved good faith efforts in all the target measures, we then have 2 years to sustain the positive trending. If we do that for 2 years, then we can petition to get out of the monitoring.
Okay. Ms. Ledoux and Mr. Lake, too, I'd like to ask you, why does Oklahoma, what are the underlying reasons that Oklahoma has so many kids in state custody, historically and now? I mean, what's causing all of this? What do you think what are the, it's a complicated question, but what are your thoughts on that?
I'll take a broad view and let Jamie jump in. It's every state is unique, and every state shares some of the same circumstances. I would say in Oklahoma, one reason is always linked to poverty. It's not child abuse and neglect. Of course, it's not totally connected to poverty, but to a large degree it is. I think you put in substance abuse, alcohol and drug abuse is another reason. Domestic violence. There are child characteristics that can contribute. Parents that aren't capable of caring for children with intellectual disabilities or behavioral problems or serious medical needs that contribute to abuse and neglect. And one of my favorites beyond parental capabilities is that what you see is with blended families or boyfriends in the home, mom trying to work, boyfriend being pressed into service as a caregiver, is a recipe for abuse and neglect as well.
Ms. Ledoux?
So I would add to that too. I think the only thing that I didn't hear Director Lake say was to talk about the behavioral health challenges, with the families that we serve. So a good portion of the families that come to our attention for the purposes of neglect. And so we, when those families come to our attention, we're really looking at the factors behind that neglect that are leading to that neglect, and many of those are what he just stated here, such as substance abuse, generational poverty, behavioral health issues, things like that. And I think we're in a position as a state where a lot of the safety nets that we have had or in the past for families aren't necessarily there anymore. And so I think that adds it's an added challenge for us because those families that are coming to our attention now, I think there's less opportunity for them to have been served preventatively, outside of coming to our attention, which adds an extra layer of challenges.
I'd like to turn to the recruitment of foster parents, foster families. You've had some good news lately. The Chronicle of Social Change found that among 25 states they examined, Oklahoma outpaced all of the states in foster care capacity growth in the last 5 years. So rose by more than 3,300 foster homes from 3,300 to more than 5,600 last year. So now we have finished the year, or last year, with more than 9,000 living in state custody. So what did you do to achieve the growth?
I think what's interesting about that, what's interesting about that is, as successful as we've been in terms of recruitment, we're still not where we need to be. We still have a lot of challenges in, finding families who can serve large sibling groups, for example, or children with special behavioral needs. We were fortunate in that when we started undertaking this effort several years ago, we entered into a partnership and decided that we were going to, engage the community in serving these kids, helping us serve these kids. And so we are working with a set of providers who are doing the recruitment and retention for us, and that has made a significant impact on the work that we're doing. We still retain a portion of that work ourselves, and that we still recruit and support foster families as well, but we have a number of private agencies who are doing that recruitment and retention alongside us, and so that's made a significant difference. Another thing that I have to point out is the relationship that we have with the governor's office, with the Oklahoma Fosters campaign, and really being, Governor Fallon really being the voice and making a call to action for Oklahomans to step up and serve Oklahoma's children. And when that occurred, we really started seeing a significant turn, in the number of families that were coming to our attention and wanting to serve our kids.
How many providers do you have now? That's new then, right?
So the number of providers that we are contracting with now, I think we are up to about 11 different contractors that are doing the just traditional foster home recruitment.
Is there some risk that takes some control out of your hands in terms of the placements and the selection of families?
So they certainly help us with that. So they recruit their families, and then what we do is when we need to match the children with a foster family, we put out a call to every one of the agencies, and they put forth the families that they have available that would be a good match for that child. And so they help us match that child, but then ultimately the decision comes down to us, to make the decision that we feel is best for that child. So they bring the family, and then we help match that way. But what we have seen is these agencies really do a phenomenal job of supporting the families. It provides an extra layer of support for these foster families, and so I think it has helped us. In terms of the families that they're serving, it has helped us really be able to provide additional support so they can care for the kids, and it's helping us be able to retain some of those foster families better.
There are 2 points I would make about that. One is some of the real success we've had. After the launch of the Pinnacle Plan, and because of everything that had gone on here in the child abuse deaths, we saw a tremendous spike in the number of children coming into our care, and that's pretty typical of jurisdictions that have those kinds of problems. The agency staff, the courts, and the district attorneys, even law enforcement, are all concerned that they'll make a bad judgment and something will happen. So the idea is the safest thing is to bring them into care, which isn't good for children either. So our population exploded. Within 2 years, we had a 23% increase in the number of children in our care, up to 11,500, which is just absurdly high number for this state. But now, through lots of efforts, we're down to about 8,700 in our care at the end of each month at this point. The point being, it's a lot easier to have foster family homes for children when you don't have so many children. And so as a result, we have been very successful in moving children into family settings, whether that's what we call a kinship or a relative or a known person kinship home or a regular foster home. Something around 93%, I think, of our children are going into a foster home, not into a shelter or a group setting, which is good for children. Second point I want to make is that we appreciate the chance to be on this program because there's a danger both in our overall efforts at reform and also in foster care recruitment specifically that you get into sort of what I'd call reform fatigue, that you hear about us needing foster parents over and over and over, and people sort of get, tuned out to that message. And so if there's something we would want to reemphasize today, it would be we still need foster homes. We would like to be one of the states that have foster homes in waiting for the next child up, and we're still a long way from that.
I mean, the numbers are still high, I take it, in terms of children in state custody. And I know in some other states recently there have been reports that the prescription opioid abuse crisis has driven a lot of kids into state custody. Is that happening here, or do you not see it?
Well, we certainly see substance abuse problems. I would say that the most difficult cases and the most serious cases are still methamphetamine related, not necessarily opioid.
What about marijuana?
And that too. It's usually in combinations. People that are using recreational marijuana are not so out of control or not are still able to provide care because it's a recreational drug, whereas with methamphetamine or in combination, it's a person that can't figure out things for themselves, much less their children.
Ms. Ledoux, what works best in convincing families or single people to turn their homes into foster homes?
Mm-hmm. I have to say that one of the things that's most impactful actually is word of mouth. So when there are other foster families who have stepped up and opened their homes to children, and when they can share their stories about the positive impact that it's had on the lives of their family members, I think that's the biggest kind of recruiting tool that we have available to us, to be able to share those stories. We've partnered a lot with the faith community, because what you see there is, the values in terms of serving your community and helping people in need are the same. They're really aligned with what our values are as an organization. So we've seen a lot of success there. And so going to those areas and asking people to not just to open their homes to the children, but to open their families to be able to serve the families of these children as well. Because, we're really trying to change their narrative around what foster care is, because we really want, we have a value of keeping families together, preserving families whenever that can be safely done. And so when we bring children into foster care, it's with the intent of working with the family so that those children can safely return to that biological family. And many of these families that come to our attention, they've burned a lot of bridges because of actions they've taken in their own lives, and they may not bring a lot of support systems to the table with them. And so part of what we do, when we have them in front of us is help them build up those support systems, both the natural and then the formal support systems as well. And foster families really have the ability to step up and provide some of that support for families. And so it not only helps us be able to reunify those children faster because they have that support, but it also provides a link to those children when they do go home. So the foster families can stay engaged, in the best of circumstances, not always, but in the best of circumstances, what we would like to see is that foster family continue to be part of the extended family, of that biological family. And when that works, it's really an incredible thing to see.
It must be tricky, though. I mean, there are the realities of caring for children and, of course, the joys. What are the biggest misunderstandings about foster care? What are the realities?
I think of course, I've never been a foster family. I have a lot of respect for families who can step up and open up their family to care for other children, but also to make themselves vulnerable, because we are asking them to make themselves vulnerable because we want them to love these children like they're their own, but then to be ready to give them up, when it comes time for those children to go back to their biological families. And so I think that is from what I hear from foster families, that's the biggest challenge. They love these children, and it's hard to get to the point where you could help make that transition home. But like I said, we have a lot of foster families who really understand that that's what fostering is about. And so when they provide that support to the families, it really is just incredible to watch. I think bringing children into your home that are known to you is one thing, but bringing children into your home whom you've never met and whom have experienced great amounts of trauma, that I think is one of the biggest things that is hard to prepare somebody for. It's really hard to prepare somebody for what that looks like when you bring a child into your home that you know very little about, because sometimes we don't always necessarily know a lot about them up front, and we don't always necessarily know what trauma they bring with them. So we rely a lot on our partners, to be able to help support foster families and help understand what the needs of the individual, unique children in their homes are, and to help provide the support to the families to be able to care for them and meet those needs.
For the more troubled kids, of course, you may need to put them in a shelter. But I know one of your goals from the Pinnacle Plan is to close those shelters or reduce the usage of the shelters. And we have the one shelter, Laura Dester Shelter in Tulsa, still open. Mr. Lake, is it going to be closed at any point?
Yes, that's definitely high on the agenda. First of all, we as an agency, I don't believe, need to be in the business of running shelters or group homes ourselves. That's for the private nonprofit sector to do. And however, what has happened is we have been very successful in not placing children with other shelters all across the state. We closed the shelter here in Oklahoma City a couple of years ago. What we found at the same time is we were able to find family placements for kids that the children then in need of placements are children with high needs. So typically no place to go, nobody to serve the children appropriately, and we've had to continue using the shelter in Tulsa to take care of those children. But we're working on plans as we speak to accelerate the development of some higher-end placement opportunities, resources for kids, and to move as quickly as possible in bringing that population down and getting out of that business. Now, that doesn't mean would just abandon the facility. We're looking to repurpose it for for another placement opportunity.
Speaking of the providers, of course, I need to ask you about the one issue that has come up recently from the bill passed by the Senate, which would allow, I guess, faith-based providers to choose not to be involved in placement of with a family who, same-sex couple, or perhaps a unmarried couple, maybe someone who's single. There's controversy over this. What are your thoughts about that bill?
Well, I think it's a solution in Oklahoma in search of a problem. I understand, because it's been a nationwide effort to do that, but we really haven't had that issue in Oklahoma, that on either side. Jamie, you can add to that. Part of it is, for example, Catholic Charities in Oklahoma isn't heavily into child placing like Catholic Charities might be in another state. So some of these issues just haven't come up.
And ultimately, when it comes down to the placement of children, we need for children to be in a placement that can respond to their unique needs. And so that's already taken into consideration. If there's a conflict in terms of values or faith or whatever that is, that's taken into account when we make the placement. So it really hasn't been, as Director said, it really hasn't been a problem that we've needed to look for solutions to fix.
I think their concern is that because you're increasingly using third-party providers, that it might grow into a problem.
And ultimately, we want families for all children, for all unique needs that our children have who come into the system. And so we want every family who is willing and able and meets the requirements to be able to come into the system, whatever that avenue looks like. And so we have a responsibility to make sure that those families come into contact with us, so we can bring them into the system to serve our kids.
We have thousands of kids of many different characteristics. We have thousands of foster and adoptive homes that are interested and willing to take our children, and that's, as Jamie explained, that's really what we look at, is matching them.
I'd like to open it up to the audience for questions. We have Bess and Alex. To the right, Alex. So if you want to just hold your hand up, then this lady in front.
My name is Jerry Pfeiffer from americastakenchildren.com. As you know, the Families First Act was just passed in Congress. It is designating certain funding for more emphasis on keeping children in the home rather than placing them in foster care. What I would like to know is, have you given thought to that, and are you implementing? Do you have a timetable for implementation of any programs in that area?
Yeah, that's a great question, because it's using intensive services to prevent children from coming into care in the first place, or to use the same kind of services to speed the children being reunited with their families, is something we already started down the path of. And the Families First Act will allow us to use the federal funding or portion of it that we have to use exclusively for the placement of children now towards those services. In fact, a couple of years ago, we were one of the last states, I think maybe the last state, to obtain a waiver to this 4E federal funding stream that allowed us to develop very intensive services that are being evaluated now to do just what you're talking about. We also have been fortunate to have the support of the Arnall Family Foundation here in Oklahoma City and Kaiser Foundation in Tulsa to implement intensive in-home services with their financial support. And I think the returns, Jamie has more data on this than I do, have been very positive.
Mm-hmm. And I would say that Director talked about previously about the reduction of children that we've served, in foster care over the last couple of years. And I would say a great portion of that reduction can be attributed to the fact that we have been able to use, to be approved for a waiver, to be able to use the federal dollars already to provide those intensive safety services up front. So we've seen a reduction in the number of children coming in because we've been able to safely keep those kids home through safety planning and intensive services. And so I think we're in a position, we're excited about the opportunity to implement this new federal legislation and excited to have the opportunity as a state to figure out what that looks like for our kids, to engage our providers in conversations about how do we get there and how do we do this better for families so that more kids can be safely in their own homes.
Then the deal on this is really interesting and beneficial to the state, because if we use 4E funding to provide these services and are able to move children out of care faster and more of them and prevent children from coming into care, we're allowed to use the savings to do more of what's working.
Another question. Anyone have a question? In front here?
So you had mentioned that you're being monitored by a group.
Co-neutrals, yes.
Yes. And so my question is, who pays for that monitoring? Is the state of Oklahoma have to pay for that as long as you're under this monitoring? And how much does that cost, and what budget does that come out of if it's the state?
Yes, it is the state. That was part of the settlement agreement that we would foot the bill for that. I think it's $1.2 million, something like that, a year. Mm-hmm.
Just for their time?
It's three of them. Their hourly rates. They have staff. You have travel. All of that wrapped into that. They have. We've not increased the contract, and they've actually, I think, slightly underexpended most years.
Did you make a commitment to the amount of money to be spent to address some of these problems? And how is that meshing with the budget crisis in the legislature?
That's been tremendous pressure on us. The budget was developed for the 5 years of the plan, and so it sort of pieced out more upfront in the first 2 years and then lesser amounts later on. And so each year we go to the legislature and request the appropriation. We've tried to request only that was developed in the budget originally. But the legislature hasn't been able to fully appropriate our requests each time. And in some cases, those requests have grown some because, for example, one of the plans was a 5-year incremental increase in the salaries of our frontline child welfare specialists. Another was a 5-year increases in the foster and adoptive home rates. Well, the more foster and adoptive homes we have, the higher that's going to be than was projected originally, and same thing with the salaries, because we have far more employees than we have. So, but the legislature has appropriated something around $110 million for the Pinnacle Plan. However, because of the difficulties we've faced and the challenges that you never quite know when you start into something, we have moved within the department about $160 million of our own funds into child welfare to try to keep pace with our reform.
Is that going into foster care or mainly into child protective services?
It's a combination. Part of it has been the foster and adoptive home rates, but by and large, the bulk of it after the first 2 years, there were some services and positions added the first 2 years. And then after that, we found, I think it was right around 2014 fall, somewhere in there, that we were not going to be able to make much progress at all with the numbers of staff we had. That part of the pressure on us was to improve workloads. Well, with the explosion in the number of children in care, we were just spinning our wheels. So we made a commitment to figure out how to hire or how to develop enough positions to help us meet the workload measures that we're striving to meet. So right now, it's a labor-intensive business. You don't get to go around with the computer and figure stuff out and hand somebody a list of things they ought to go do. And so most of our costs are in personnel.
Any other questions? This gentleman. Right there.
I was just thinking, while you were on the topic of the frontline workers, how difficult has it been to obviously need to increase staffing, and you mentioned the workloads were, before the plan, were pretty heavy, and a lot of burnout and that kind of thing. How difficult has it been to increase that staffing and to bring on the quality of people and to retain the veteran people in order to do this, to handle this load?
It's been very difficult. We have a very sophisticated workload measurement instrument that we use and we account for, so that Jami can explain it better than I can, but she can figure out on a unit level somewhere in the state whether they are properly staffed, understaffed, or close to being properly staffed. So we have pockets in the state where workloads are reasonable, but we have other pockets in the state where we continue to have turnover where they're not reasonable, because a new person coming to us straight out of college, our only degree requirement is a college degree, have a lot to learn and a lot to experience. So we've had to put measures in place, for example, to stem the turnover in the very first year, and in fact, even the first 6 or 7 months of employment. We were finding that people would come in, have training, come back to their offices, be dumped into a workload, and just like that, they were done for, and they were out the door. So we instituted graduated caseloads so that people are not having to take a full load. Trying our best. We've brought turnover down amongst our core positions, which is after you've had experience, been there a year, you're classified as a child welfare specialist. 2, we've brought that turnover down below 20%, which is pretty good for this field across the country. We still are experiencing too much at the lower level.
So I would add to that it has been challenging in pockets, but we have been tremendously successful. And some of the things that we've done to directly impact the level of support that staff have coming in the door, and to directly, as Director Lake said, impact the actual caseload that they get coming in. We've seen and have heard feedback from our staff that has helped significantly. We have done a lot of work to decrease the worker to supervisor ratio, for example, and so we want our supervisors to have no more than 5 staff at any given time to supervise, so that they can spend that individualized one-on-one attention with staff. And so things like that have helped, in really pouring money in and leaning on the expertise we have in our state to improve our training, the training that we're providing our frontline staff, all the way from when they first come into the door all the way up to leadership, so developing our leaders, and really trying to plan for sustainability for the division long term. So while it has been challenging, we've come a long way, and what I would say to that is that being able to have an adequate number of staff to do this job so that staff can have manageable workloads has been one of the single most significant things I think we've been able to do as a state, because what we know about how you improve outcomes for families, how you achieve the outcomes that you want for the families you're working with, is directly correlated with this assigned worker's ability to have the time to engage with that family. And if they have a workload that's twice the workload that they're supposed to have, they don't have time to be out there working with that family to figure out, how can we, for example, safety plan this child in the home to be able to keep the child home, or how do we engage with the family and providers in the community or whoever to be able to work with the family so they can control the safety threat and improve the conditions in their home. Work towards visitation between the parents and children, visit the parents' home, to make sure that the home is the way that it needs to be. All of those things take time, and so if our staff don't have the time to do that, then it really impacts our ability to achieve positive outcomes for kids and families. So it really is significant that we've been able to do that, and it's been significant that we've been able to find a way to preserve that for our success.
You may be facing some headwinds. The unemployment rate is probably going to go down nationally and in Oklahoma, so it could get, unless you can boost salaries a lot, right? But this gentleman had a question.
Jami, earlier you mentioned that some of the historical safety nets in Oklahoma are not there anymore. I was wondering what some of those are, and then if because of that, what are some of the most important needs that your partners can help meet?
So I think it's a really good question. I think anytime you see decreases to even other state agency budgets, for example, you look starting with like the Department of Education and mental health and substance abuse, juvenile justice. Anytime you see the health department, healthcare authority, anytime you see decreases in those areas, it directly impacts us. And so I think we've been in this space where we've been really looking at our data closely and looking at the families that we're serving closely, and sort of preparing for the event that it could mean, if these cuts continue, it could mean that the front door to the child welfare system, opens up wider again, and that we could, have more families coming in because we don't have the resources available to keep them out. We're not there yet. Fortunately, we've been able to find a way to do that, and a lot of that has been, as you said, related to the partnerships we've been able to form. And so what we've been, I think we're honestly ahead of the game in terms of the question that was asked earlier about the Families First Prevention Act, because one of the most significant changes I think we've seen as a state, not just in the child welfare agency, but our child welfare system, is that, over the last several years, we've spent a significant amount of time building partnerships and strengthening partnerships that already existed. And so through that, we already have, there's a lot of, I think, shared values in our state about what we want for kids and families, and that we really do want kids home. And when they do have to come into the child welfare system, we want them to stay there only for a short time period, and we want them to exit, in a timely manner. And so being able to have partners at the table who support that and who get that, and who want to help problem solve that. So we've been, in conversations over the last several years with partners about, what can other partners do in terms of supporting families within the community, for example. So, and I would say, it doesn't even have to be an organization or an agency, that every single resident of this state, I think, can impact that just by, looking out for your neighbors, or looking out for, the people that you go to church with, or the kids that your kids go to school with. And providing supports to families in need. And so we've seen a lot of that. And so I think when organizations, agencies, businesses, funders are willing to step up and be a part of that conversation and problem solve that with us together, I think that's how we get to where we're trying to go with the Families First Prevention Act.
In terms of social problems in general, we have a tendency with state government to assume that the agency that has those programs owns the problem, and that is a problem, because it's the state's problem. It's not DHS or mental health. We all have pieces of it, but DHS by itself is never going to be able to adequately and totally address all of these issues. You have to have the other resources and the other safety nets in place in order to make an impact on child abuse and neglect. We're sort of at the end of the trail. We're not at the beginning of the trail. Kids are already hurt by the time they come to our attention. That's a little late. It has to be done sooner.
And you have to look on the other side of it too. So when we, the intervention of child welfare intervention, court intervention, bringing children into care, once we are able to successfully reunify those children, we obviously don't want them to come to our attention again. We want them to stay there. And so, the same amount of resources and supports that are needed on the front end to be able to keep children from coming in, we need those families to have those supports on the back end as well, because we know it's challenging after they've gone through, the trauma of having come to the attention of a department, and there's the added trauma of those children being removed. And so, having people who understand that in the community and who can help provide those types of supports to families on the back end so that we don't have to intervene again. And fortunately, we have been in a space, one of the measures that we've been looking at is our reentry measure. And so we want children to stay home once they come home or once they go home. And that's one of the areas that we have been successfully improving our performance in. So we know that children now, once they go home, are more likely to be able to stay home than they were 4 years ago. So that's a huge success for our state.
Other questions? Right here.
You mentioned the reduction of number of kids in custody, which is a good thing. I think we're all that's a goal that everyone supports. I'm wondering how much of that is because the kids are reunified, and how much of that is some of the recent measures like safety plans, which has not been always in place, and then. So I'm a foster parent, have been since 2008, off and on, and many, including a case we're on right now, there seems to be a increased push for guardianship. So they kind of pushed that toward us. We had a kinship that we right now. So we safety plan first, straight to guardianship, which would have meant the child was never technically a number on the roll in custody. And we felt that left us pretty vulnerable. Guardianship provides much less support, as you know, than for the caretaker family and foster care does. So I'm wondering, one, kind of how much of that reduction has been reunification versus some of these other measures. And number two, does the Families First Act provide some funding that would let you support these families doing these other caretaking measures more than you do now?
That's a really good question. It's really, the equation is in and out, so that the success in bringing the numbers of kids in care down does have a lot to do with reducing entries and then also increasing exits. The guardianship issue is something we have struggled with because we've gotten feedback that maybe at some points we're a little pushy on the guardianship and send the family down to the guardianship court, which that maybe they don't appreciate sometimes. So that's supposed to be a viable alternative for children and guardians who want to move beyond fostering but don't want to make the adoption commitment, and probably should fill in the blanks there.
So it has been a combination of both of those. One of the biggest contributing factors on the back end, so we call it the front and the back end, so bringing kids in and then exiting children, one of the biggest contributing factors there has been really looking at timeliness to permanency. And when we saw this explosion of kind of kids coming into care and the numbers going up, one of the things that caused is it caused us to sort of slow down on our efforts to exit kids from the system. And so we had a large number of children who had been in the system for a long time period. Many of those children were already legally free for adoption or close to being legally free for adoption and already in a placement where they identified permanent placement for them, so a family who wanted to adopt them. And so we had a really big push about 2.5 years ago that we were going to focus on exiting those children, the ones that we knew we could exit out quickly because they no longer needed our attention, they just needed permanency. And so doing that, we got a large number of those children out, and as we talked about on the front end, what we were able to do there. And so now our focus really is on, now that we have approached it from both ends, now the focus really is on, so those kids coming into the system, how do we increase the likelihood that their experience in the system and the time that they're in system is going to decrease? So what we know about where you really make the change is from that moment we first come in contact with that family. It's one thing to create a set of solutions to get children out of the system who've been in the system, but to develop solutions about how do we work with families differently from day one, that's really what we're working on now. So that we can ensure that we're exiting as many children as we can. The federal standard is really within 12 months. So we want children, if their goal is reunification, to exit within 12 months. And in terms of the guardianship issue, I don't know the specific circumstances, obviously, of your case. We are pushing guardianship for children who are in care, if it's appropriate for that child. We're really encouraging our staff to really look at the individual needs of that child and that family. And for some children, it may be that they don't need to go the adoption route, such as if you have, grandma, for example, who has children in foster care in her home. Maybe the biological parents can't necessarily care for that child, but maybe need to stay involved in that child's life. So do their rights really need to be terminated, or can we pursue just guardianship where grandma becomes guardian of children? So it really is an individual basis what's best for those children. As far as on the front end, it's generally not a practice that we engage in to push guardianship as a means to keep children out of custody, because, as you said, that doesn't necessarily address the issues that cause those families to come to our attention. So it doesn't provide us the opportunity to help control those safety threats and allow for the family to, alleviate or eliminate whatever that safety threat was. So it's generally not a practice that we engage in, but it doesn't mean it's not necessarily it's not an across the board thing. It really is an individual basis too.
I think we had a question from this woman here in the center. But I want to quickly ask, in terms of the experience of being a foster home, you promise a number of things: training, reimbursements, support. How do you think you're doing in terms of, say, let me pick a couple of things we've heard. Many foster parents are totally confused about the court system. They don't know, they don't understand what's going on. They don't feel like they're communicated with about what's going on. The parents may not show up in court. And then, are reimbursements getting made on time?
Mm-hmm. So that is one of the, I would say our foster families find that to be one of the most challenging things in terms of just understanding and navigating our system. And that's not even specific to foster families. Our biological families say the same thing. It's an intimidating process. And so we have spent a lot of time with our training with foster families. And when I mentioned the contracting mechanism that we use now to bring families into the system, that's an extra support for that foster family to be able to help be that, just guiding them through what the process looks like. So a family is going to have both a worker assigned to them, their worker, and then the children in the home are going to have their worker as well. So they have two supports. A lot of the private agencies and even our agency as well, they have very specific, I would say, support programs for their foster families. There are a lot of support groups out there for foster families. So, connecting foster families with foster families who have stepped in and have learned how to navigate the system, I think is a big support. We also have a foster care ombudsman, which is a huge support for our families as well. So if foster families are experiencing challenges navigating the system or are unhappy with, the service that they're being provided by the department, they do have the ability to access this foster care ombudsman who does a phenomenal job of working with that family to get their questions answered, to remove any barriers that they're facing in terms of, getting access to services for kids or whatever. So there are a lot of different types of supports out there for families. We need more. So that's one of the things that we need from the community. If that's a passion or something that individual organizations are interested in supporting or even funding, there's a huge need to find ways to better support foster families to be able to care for these kids.
Thanks. I'd like to go to this question.
In the first question about the Pinnacle Plan, Director Lake stated that we still had a long way to go in some areas. Can you explain what some of those areas are where we still have a long way to go?
Mm-hmm. A couple of areas jump out. I think what is called in the report or the measures is placement stability is still a challenge for us. That you don't want children having to make multiple placements through the system. You've heard, I'm sure, of kids that have been 20 different placements in the system, and that just ruins a child. That, though, is tied to another issue, which is having a sufficient, appropriate resources for some of the kids that are more challenging. And so that's something we've been having develop almost out of whole cloth, and the state still doesn't have enough of those kinds of resources. Another one that's really hard to explain, but it is a measure that is troubling to us, but also you have to put in context, and that's called maltreatment in care. And how many children and what % are harmed while they're in care. And of course, we don't want that to happen. The child's already been harmed. We don't want children reharmed in the system. But it's a very incremental approach you have to take. For example, our goal, our target is 99% of children are not harmed while in care during the period that we're accounted for. We're at 98.68%. So that means that out of the 15,000 or so children, distinct children that are coming in and out of the system over the course of a year, about 202 have had some sort of harm substantiated. The goal would be 151. So we're talking about 51 children fewer being harmed in order for us to meet the goal. It's like anything else. When you get to like 98%, getting that last 2% is the hardest challenge. Also, you'll read where we're on a misery index. We're at the top of the list nationwide, but that's because of we're using the measure that we're required to report to the federal government. The problem with that is states define abuse and neglect in myriad ways. So it's not apples to oranges, but it's maybe oranges to tangerines. When you're trying to use those statistics, it can be deceiving. So that's an area where we're still working really hard to improve that picture. So I think those three areas.
Another question. This woman in the back.
You addressed this briefly earlier, but you had said that you had recently started using private companies to recruit families. I think you said 11. I was just curious, what techniques do you use? What specific techniques do you use, oversight techniques do you use to ensure that you're getting quality families for our foster children? And Director Lake mentioned that some of the issues that we're still struggling with were placement stability and maltreatment and care. I wonder if there's any connection with the number of private companies we're using to recruit foster families and how we're still struggling in these two areas.
That's a good question, and actually the children in the contracted foster homes, their rate of maltreatment and care is slightly lower than in our foster homes. So Jami mentioned earlier that I think one strength of the private groups have been a great amount of attention to supporting the families. And because they don't have as many families, sometimes that's an easier course than we have, where we have thousands more than an individual contractor does.
And so I'll answer the first part of that question about the oversight in terms of the quality. This is an ongoing process for us. It's one of those situations where we're constantly evaluating sort of what's working and not working in that area. And we have the ability to undertake really complex analyses to understand what's occurring and what is behind, incidents of maltreatment and care. And so we know kind of what the, I guess you could say, red flags are and the things that we look for that are possible contributing factors to when a child, when we do get to the point where we've substantiated and have confirmed that maltreatment has occurred. And so we put a number of things in place, and wish I could talk about this entire time, but really we focus a lot on through that approval process. It's more than just, is the home appropriate? Obviously, we have to look at the history of the family. So that, there's the background checks of the family. And when I'm talking about background checks, I'm not even just talking about criminal record, but, we look at have they had child welfare history, what we refer to child welfare history, which would be have they come to our attention before for an allegation of abuse or neglect. But then we also look at social history. That's one that becomes a little bit more complex because it's not a black and white situation, but we thoroughly evaluate the social history behind a family and the dynamics in the family, look at references, check references, people who know the family, who can attest to their ability to bring children in their home and care for children. And then we have a lot of oversight on top of that. So once the decision is made that this foster family meets the criteria and can safely care for children, we have a lot of oversight on that family. And we've put a number of checks and balances in place to make sure that the ongoing evaluation assessment of these families continues. So it's not just we bring them into the system and then we set them off and we never, check on them again. But we have a number of things in place that provide, extra set of checks and balances. And Director Lake mentioned, what we call the code neutrals. They have even said that, the things that we've been able to put in place in terms of the oversight and monitoring of these homes to be able to work to prevent maltreatment and care, that it's a very robust and one of the most robust systems that they've seen in place across the country. We're continuing to work on it, and we'll continue to expand it, as we learn more about what contributes to maltreatment and care, because really until we get to the point where 0 children are being abused or neglected in our care, then it won't be sufficient.
I will take one last question for the forum. Anyone have one? If not, I'll ask a question. My overall impression is that you're almost there, but are you really? So I would ask as a journalist, if the co-neutrals were here, what would you say, what's your perception about what they feel? Are they satisfied? Do they think you're just almost there? Are they frustrated? What do you think?
Well, because they've said it to us, I would repeat what I actually said early on, which is they would say that we've made tremendous progress in some areas and need to make more progress in other areas. That's really what it boils down to. I think if you look at the commentaries over time, you can see a steady progression of positive comments and reporting and our efforts to move towards these target measures. But as you get closer and closer, it gets more and more difficult, and we've pointed out a couple of the areas where we've still got work to do. I would like to say also that I didn't have a chance to say this earlier, but understanding basically the lack of a child welfare system in Oklahoma before all of this is important to understand why it takes a while to get things going. For reasons unique to Oklahoma, DHS was pretty much the only game in town, and so we don't have in Oklahoma still major child welfare providers who could help in the system like other states do. And so part of our challenge has been, while we're trying to work our own plan and get our own act together, we're trying to develop a system that didn't exist. And that has been a dual challenge. And when the state is able to have a vibrant and comprehensive system to serve children all along the continuum, we'll know we were there. But we're as a state still a good ways away from that.
So I would like to add to that too, because I think we get that question or similar questions frequently. And one of the things that I always want to stress is that exiting the Pinnacle Plan, exiting the lawsuit, exiting the settlement agreement is not the end for us. It's not the finish line for us, because ultimately what we've been trying to do over the last several years, in addition to meeting these targets that we have set out for us, we have been pouring a lot of resources into our system so that we can establish ourselves really as a self-correcting system, so that we have mechanisms in place to kind of flag what's working and what's not working, so that it's an ongoing, continuous quality improvement system that we have, so that when something's not working, our data flags us to that, and we can quickly make adjustments to be able to take a different course and, create different interventions for families. And so we won't stop working to improve the system for kids and families, even after the settlement agreement is gone. And I would say that, until we get to the place as a state that we as a state are able to ensure that every kid who can stay home safely can stay home, and that when children come into the system, those are the children that absolutely had no other option but had to come in. And then once they come in, they're in a family setting, they're with families, they're stable in those placements, they're not bouncing around while they're in foster care, and that they're exiting the system as quickly as they possibly can, either through reunification or through adoption. So I would say until we get to the point where our system is in that place, that we're not done, and we won't stop working to establish that even after we meet these targets or these measures set out in the Pinnacle Plan for us.
Thank you for your time. Please give our guests a hand of applause.